The country is experiencing an escalating human resource crisis with non-deployment of medical pre-interns and salary delays for health workers in some hospitals, plus stock out of medicines. However, according to the approved annual budget estimate for the financial year 2023-2024, the health sub-program are set to suffer 181.6 billion budget cut compared to the financial year ending. A statement by civil society organizations read by the Executive Director, Forum for Women in Democracy, indicates that health systems experience a staffing gap of 35%, yet the budget framework paper indicates the wage bill for delivery of primary health care will be cut by 3.48 billion shillings.
This also contributes to increased cases of maternal and infant mortality, owing to the time-sensitive nature of childbirth and delicate nature of infants. The Ministry of Health also needs to develop and submit a costed human resource plan elaborating how it intends to progressively cover the highlighted human resource gaps to the optimal levels that were set in the NDP3 framework.
The Member of Parliament, Chegegwa Kabahenda Flavia, says government needs to look at investing in universal health coverage, stressing the need of restraint to cut the health budget by 11.8%.
A country that does not invest in primary health care, we only wait for people to come when they are sick and we can't prevent. We only are on curatives. We want immunization boosted, not only for these simple immunization, but the kind of diseases that are coming around require that we invest much more in immunization.
According to the Center for Health, Human Rights and Development, the budget for national medical stores has a funding gap of 240 billion shillings to avail essential medicines, where the Ministry of Health remains non-committal to raising resources to fund the approved staffing structure.
Health organization recognizes that you cannot, using the budget alone, have adequate resources for health. And so they have recommended that the best alternative is to adopt health insurance mechanism as a means of pulling resources together to improve. Now,
The woman Member of Parliament, Cassandra Flavia Kalule, expressed concern over the 1.9 trillion shillings for the classified budget.
In the minority report, we actually rejected this 1.9 trillion, and we were calling on Parliament as well to reject it so that we can reallocate this money to critical sectors, because
civil society organizations say the gender unit under Ministry of Education and Sports that is meant to ensure planning and monitoring the implementation of gender-responsive policies is poorly funded. I'm Navka Farida and Dan Lugemwa in Kampala.